Hello, my name is Dr. Doug Olson. If you are watching this video, then you have decided to make a big step and a large investment in your future quality of life by having a joint replacement surgery. You've decided that you no longer want the pain and stiffness of arthritis to dictate your quality of life and the type of activities that you enjoy. I have created this video in hopes of providing more information to you and alleviating some of your stress and anxiety about your upcoming joint replacement surgery. You can also share this video with your family members and your caregivers who will be caring for you after surgery. In this video, we will discuss all of the aspects of your upcoming joint replacement surgery, whether it be shoulder replacement, hip replacement, or knee replacement. We will discuss the preoperative evaluation, as well as your hospital stay, your surgery, your postoperative care, and also your recovery once you leave the hospital, and long-term expectations. It is important to remember that every patient's case is specific, and this video is for general informational purposes. If you are watching this, then you have been selected as a candidate for a potential partial knee replacement. This means that for your knee arthritis, it is specific to one area of the knee. With a partial knee replacement, we resurface just that worn out part of the knee and leave the rest of your healthy knee intact. With a partial knee replacement as compared to a total knee replacement, this means that I can leave your own ligaments intact and that I do not have to do any surgery to the kneecap. The benefits of this is that there is less surgery involved, so it is less invasive. Typically, you recover much faster, and typically, your knee feels more normal than a total knee replacement. It may not feel exactly like a normal knee, but it typically feels less mechanical. Another benefit is because I did not have to do anything to your kneecap, typically you are still able to kneel on the knee after your surgery. Also, one other benefit is people with a partial knee replacement typically have better range of motion, meaning that they are able to bend their knee back farther than those patients with a full knee replacement. It is important to know that although we will be planning on a partial knee replacement for your surgery, with every patient that I take to the operating room to plan for a partial knee replacement, I inspect the rest of the knee and I look at your arthritis pattern to determine if the rest of the knee is worn out as well. Occasionally, the rest of the knee looks worse than your x-rays did, and if you need it, we proceed with a full knee replacement at that time. This is an x-ray looking at a knee from the front that is representative of someone who has arthritis, which is specific to one area of the knee. Specifically, we see that on the inside part of the knee, the joint space is narrowed, meaning that the cartilage is worn down, and there is a bone-on-bone appearance. On the outside part of the knee, we can see that there is still more joint space, meaning that there is good, healthy cartilage in that area. This x-ray is a lateral or side view of the knee, again, which is representative of someone who has arthritis focal to just one area of the knee. On this view, we notice that underneath the kneecap, there is still good cartilage, and it is not bone on bone. This is another x-ray of a knee where the x-ray beam is angled underneath the kneecap. The reason we take this view is to determine if there is arthritis underneath the kneecap. For patients who have arthritis specific to one area of the knee, typically they do not have arthritis underneath the kneecap. For instance, here we see that there is a large joint space, which means good cartilage still present between the kneecap and the femur. These are all things that I am evaluating during your preoperative visit as to whether you are a candidate for a partial knee replacement or whether you require a full knee replacement. Now I'd like to discuss with you the actual surgical procedure of your partial knee replacement. Once you are brought back to the operating room, the anesthesiologist will typically have already discussed with you whether you will be receiving a spinal anesthetic. This is where they use a numbing shot in your back to help make your legs go numb and then put you off to sleep. If this was the case, this will be performed at this time. Then you will be given the anesthetic and you will be put off to sleep. With a partial knee replacement, you will have an incision on your knee that is slightly off center because it is focused over the area of your knee that is worn out. As we discussed before, once I am inside your knee, I look at all of the parts of your knee, and at this point I determine whether we proceed with a partial knee replacement or whether you need a full knee replacement. If your arthritis is diffuse throughout the knee and looks worse than your preoperative x-rays showed, then we proceed with a full knee replacement. This is pretty unlikely. Usually when we go to the operating room planning on a partial knee replacement, we proceed with a partial knee replacement. However, it is important to know this prior to the surgery. The surgery itself involves me removing just the very arthritic, worn out end of the bone and then putting in an implant to resurface the bone so that the arthritis in that one area of the knee is gone. Typically all of the stitches that we use when we close your incision are underneath the skin, and typically the skin is glued shut. We then place a sterile dressing over your incision, and you have an ACE wrap over the extremity from your foot up to above your knee on the thigh. This is a picture of an x-ray of the knee from the front after having a partial knee replacement. Here we see that the inside part of the knee that was once bone on bone is now resurfaced with the metal femur implant, the metal tibia implant, and then there is a plastic liner in between. The rest of the knee that did not have arthritis is maintained and did not need to be replaced. This x-ray is a lateral view of the knee or a side view and represents an x-ray of a knee after having a partial knee replacement. Again, what we see here is that the arthritic ends of the femur and tibia have been replaced with an implant only on the worn out arthritic part of the knee. Underneath the kneecap, I did not have to replace or resurface that area of the knee because the cartilage was still good. There are a number of things that need to be done prior to surgery in order to prepare you to ensure your best chance of a successful joint replacement surgery. Each of these things apply to you whether you are having a shoulder replacement, a hip replacement, or a knee replacement surgery. First, you will need to identify one or multiple people who will be your primary caregivers after surgery, as they will want to watch this video as well in order to better prepare themselves as to how to help care for you. The next thing is we will need to obtain medical clearance from your primary care provider. This entails some basic routine blood work, as well as a urine sample, as well as a nasal swab to ensure that you are not carrying a harmful bacteria on your body. If you have diabetes, we will want to make sure that that is well controlled prior to surgery, as this can help reduce your amount of complications after surgery. Also, if you use nicotine, such as from cigarettes or any other nicotine devices, it is definitely recommended that you stop all nicotine use prior to surgery, as nicotine is shown to increase your risk of complications such as blood clots and infection. Now I would like to discuss some of the possible risks or complications that can be associated with your upcoming joint replacement surgery. This is not meant to scare you, but it is important to discuss these things so that you have a firm understanding of the possible risks associated with your surgery. I will discuss some common potential risks that are common to all joint replacement surgeries, meaning shoulder, hip, and knee replacement. And I will also discuss some that are specific to each of those replacements. In general, there's always a risk of infection with a joint replacement surgery. Fortunately, this risk is rare. However, we always worry about the possibility of infection because it can cause increased pain and stiffness and lead to further hospitalization and surgery. We do a number of things to help prevent infection for your joint replacement. Another potential complication is that of a DVT or blood clot. Again, we do a number of things to prevent this, including mobilizing you quickly after surgery. You will wear compression socks on your lower extremities if you are having a hip or knee replacement surgery. We also will place you on a blood thinner if you are having hip or knee replacement surgery. Now, for the vast majority of patients, this will entail taking a baby aspirin or an 81 milligram aspirin twice a day for 4 weeks after your surgery. If your medical history places you at a higher risk of a blood clot, then we may have to use a different blood thinner. Another potential complication is stiffness of your joint after your surgery. This is where physical therapy and your activity level play a large role. Physical therapy is used to help get the stiffness out of your joint and get you as much function out of your joint as we can. There's a very small risk of dislocating a joint replacement after the surgery. Fortunately, this is very rare. In general, with joint replacement surgery, there is also a risk of injury to other structures during your surgery, such as nerves or blood vessels. But again, this is extremely rare. Whether you're having a shoulder, hip, or knee replacement surgery, when you show up to the hospital the day of your surgery, you will be registered at the registration desk. You will then be brought back to the preoperative area where you will meet our excellent preoperative nurses. They will start an IV and likely give you some medication to help relax you. You will then meet the anesthesiologist who will be administering your anesthesia during your surgery, and they will discuss a number of different techniques about the anesthetic to provide you the best and safest anesthetic for you and your medical history. With any joint replacement surgery, the anesthesiologist will discuss a nerve block procedure. This is a procedure done in the preoperative area where the anesthesiologist uses an ultrasound machine to identify and see the nerves around your shoulder, hip, or knee, and then inject some numbing medicine into that area. They typically will place a catheter underneath your skin for shoulder and knee replacement surgeries. This typically stays in for 4 to 5 days and is connected to a ball of numbing medicine. What this does is it blocks your brain's ability to sense some of the pain from your surgery and helps control your pain significantly after surgery. Once all of this is done, you will then be taken to the operating room where you will meet the members of your surgical team. Your anesthetic will begin, and then we will complete your operation. After your surgery, you will be taken to the recovery room to recover from the anesthetic. Once you have recovered, you will be seen by the physical and occupational therapist, who will show you a number of exercises and also help you get up out of bed and get you walking right away. And we'll make sure that you're safe to go home. Your leg will be wrapped up in an ACE wrap from your foot up to your upper thigh. You will be given compression socks to take home with you, and you will put those on the day after surgery. Typically, you will go home the same day of surgery. Rarely, if needed, you will be kept overnight and will be discharged home the next morning. It's important to remember that all patients will recover and heal at different speeds. But in general, you will have physical therapy approximately 3 times a week for 4 to 6 weeks after your surgery. Typically for the first week or two, you are using a walker to help get around and walk. And I will see you at your first post-operative visit 2 weeks after surgery. At this point, we take an x-ray to make sure that the implants look good. I will inspect your incision and also inspect you for any potential complications. You will have the opportunity to ask any questions at that point and get those answered. You will continue your physical therapy, and usually by 2 to 4 weeks after surgery, you are walking without any assistive devices. I see you at 6 weeks after surgery, and at that point, most people are able to get back to most jobs. When you leave the hospital, you will have appropriate pain medication, and I encourage you to take this when you have pain, but also to try to limit how much you take to prevent the potential side effects from the opioid pain medication. I encourage you to take a stool softener to prevent constipation, and I also recommend that you take an anti-inflammatory such as ibuprofen if you are medically able to. By 6 weeks after surgery, most people have made a significant recovery and their arthritis pain and stiffness is much improved. However, at that point, you will likely still notice occasional aches and pains, particularly at night when you try to sleep. You will continue to recover and improve up to an entire year after your surgery. Also, a commonly asked question by most patients is when they can start showering. Typically, the surgical bandage that we use is watertight and you can start showering right away. The surgical bandage gets removed 5 days after surgery, and then you can start showering with nothing over the incision. We do, however, ask that you do not submerge the incision in water, such as in a pool or in a hot tub, for 6 weeks after surgery, which ensures that the tissue is completely healed. For patients having a shoulder and knee replacement, you will have a nerve block bandage that holds the nerve block catheter in place. This may make it difficult to shower initially for the first few days, but once this comes out, it will be much easier. There are a few things that are important to know long-term about your partial or full knee replacement. First is that with any knee replacement surgery, you will have some numbness on the outside part of your knee. This will improve as the years go on, but you will likely always notice some numbness in that area. Second, you may feel a click in your knee with certain motions. This is normal. Some people feel it and some people don't. Another thing to remember is that you should not compare it to a normal knee, and that although the surgery is designed to improve the pain and stiffness that you have from your arthritis, it does not mean that you will never have another ache or pain in the knee. On average, you can expect your partial or full knee replacement to last at least 15 or 20 years, sometimes less, sometimes more. I encourage you to be active after your partial or full knee replacement once you have healed up. This involves mostly low impact activities such as walking, hiking, biking, swimming, even skiing. However, we do not recommend that you do high impact activities such as jogging, running, or jumping. I hope this video has given you more information and helped alleviate some of your anxiety about your upcoming joint replacement surgery. Please feel free to share this video with your family members or your caregiver. If you have any questions that this video has brought up, please feel free to contact my office, as I want to make sure that you get those questions answered prior to surgery. Thank you for entrusting me with your care, and I look forward to seeing you the day of your surgery.